We're outside Civil Hospital in Karachi. The people you see behind me are not here because of a natural catastrophe or the pandemic. Although affected by it, their conditions are pre-COVID in the similar fashion. These massive crowds you see thronging the place, waiting for their turns, is not a problem at this hospital only. This is a usual scene in most public hospitals across Pakistan. According to a WHO report, the doctor-to-patient ratio in Pakistan is alarming. 1:1300. Ideally, the ratio should not exceed 1:1000. What makes the situation worse is the doctor-to-nurse ratio in Pakistan, which is 1:2.7, as opposed to the WHO recommendation, which is 1:4. That means the healthcare professionals need the best leadership and management skills to tackle the patient load, that too with inadequate support. And interestingly, it is a missing link in our healthcare delivery models.
We are working here and sacrificing our lives from 8:30 a.m. to 2 p.m. But it is exaggerated due to the overflow of the patients. We are working here with the limited staff and facilities and stuffs like that. There is so much burden on us. There's basically no staff, no working facilities.
And limited type of supplies like medications, like other rehabilitative things, like prosthetics and many other stuffs. And very limited surgical machinery over here, because the workload is very extensive. We do get in, take an example of our ward. There are only 100 beds in ward 6, and we do take 50 beds extra. And on that hand, not only the staff is exhausted, it's a multidisciplinary exhaustion, which comes over to the house officers, over the PGs and the senior consultant which do work over here. Our literacy rate is very much less. That eventually today even they don't believe that corona does exist. They are very concerned about the vaccination. The mentality we face is very much difficult to be put on.
So at PharmEvo, we pursue a dream of a healthier society. When we saw the burden on a healthcare structure, we thought about how PharmEvo can contribute to making things better. The idea was to equip the healthcare professionals with adequate management and leadership skills to effectively and efficiently manage the burden and effectively utilize the resources in hand. Aga Khan University, a famous university of our country, published an eye-opening report named Leadership in Healthcare is a Neglected Issue, a call for action. So according to which, there's a clear lack of focus on developing leadership skills and training program for healthcare professionals, despite the evidence of benefits of such training to the healthcare professionals. Also, assessment at undergraduate and postgraduate levels does not assess for leadership skills of those professionals, since it is not in their curriculum. According to National Health Service UK, traits such as emotional expressiveness, self-confidence, self-determination, freedom from internal conflict, and communication skills are crucial for any leader, especially the healthcare leaders, because they deal with these situations every second. Undoubtedly, the healthcare professionals in Pakistan are some of the most technically skilled in the world. Still, they lack the necessary soft skills, as they are not taught in their academic institutions or incorporated into the healthcare professionals' on-job training. That is why we laid the foundation of Institute of Leadership Excellence, ILE. It works to enhance the capacity of our healthcare professionals and helps them transform into visionary leaders who can create value in the healthcare delivery models. My colleague, Dr. Masood Javed, will elaborate further on this project of ILE.
We at ILE are working at many different initiatives to improve the competency of our healthcare professionals in the area of leadership. we have developed many engaging practical workshops to train at different areas. To name a few, we have a workshop of leadership in healthcare. Another of our workshop is 7 habits of highly effective people, which we conduct in collaboration with Franklin Covey. In the same way, we found sometimes strategy but found difficulty in implementation at our workplace and our hospitals for the patient care. We have developed execution agility on the basis of implementation compass, so how you can implement your strategy to improve the patient outcome. Not only the routine workshops, we are also working for innovation in healthcare. A special signature workshop of ours is Design Thinking for Innovation in Healthcare, in which we try to find out creative solutions to the problems to improve the outcomes and the society. We have also developed a 3-month certificate course on healthcare leadership, which is available both on campus and online format. You can find out more detail about all our initiative at our website, which is ile.guru.
So I'm standing at the Tabba Heart Institute, which is one of the major cardiology hospital in Karachi. And the best part of this hospital is that this is the first hospital where we conducted the first training from ILE platform, which is Institute of Leadership Excellence. And with the support of Executive Director Dr. Bashir Hanif, we managed to conduct the first leadership training program for the Tabba Heart Institute doctors. So let's hear the feedback from the participant of the programs conducted by Institute of Leadership Excellence.
Healthcare structure and leadership in Pakistan has been a significant problem right from its inception. Institute of Leadership Excellence has taken an excellent step to solve this problem. I was one of the initial members along with my team who attended one of the courses organized by Institute of Leadership Excellence, and I can tell you that was one of the best courses I have ever attended. It was very well organized and absolutely phenomenally crafted for development of leadership in Pakistan. We learned a lot, and I'm sure this kind of courses and seminars will go a long way in terms of developing healthcare leadership and healthcare structure in Pakistan.
I recently had the pleasure of attending a workshop on the platform of Institute of Leadership Excellence, and I, along with my colleagues, actually felt that it was a very well crafted workshop involving multiple parameters of healthcare and in making the doctors aware of the new healthcare aspects to develop better habits into doctors, so that not only they get better on a personal level, but their professional development ends up improving patient healthcare on a general healthcare level. So again, I wish the whole team of PharmEvo best of luck, and I hope this platform grows so that more and more professionals can benefit out of this, and at the end of the day, our healthcare system improves so that the patient care can improve as well.
Since the beginning, PharmEvo has believed in our responsibility of giving back to the society, hence the pursuit of dream of a healthy society. Adding to what my colleague Jamshed just said, we will continue to charge ahead as Institute of Leadership Excellence plans to establish centers of leadership in 100 institutions all across Pakistan in the next 5 years. And by 2026, we employ a sizable number of training personnel for these centers of healthcare leadership and many other projects that will serve both Pakistan and the global community. Thank you.